Good morning and welcome to another Hot and Health Topics with Dr. Q. Yes, we're still working on the name, so go ahead and bring us in those suggestions and we will get back to you as soon as possible. Hello, Dr. Q. How are you?
Hello, Neil. I'm good. How are you?
I'm good. Welcome, ladies and gentlemen. My name is Neil Hutchins Resto. I am your treat fairy. Today on Hot and Health Topics with Dr. Q, we wanted to talk about dog house soiling and cat vomiting. These are two things that came into our feeds quite recently lately. So I just wanted to go ahead and say it is boot up birthday. My boots are up on my desk and I am sitting in for the long haul. Dr. Q, welcome to another episode. I'm so happy to have you yet again, and thank you very much for bringing me to your live stream channel here on YouTube. Dr. Q, can you tell us, how do you say your name again?
It's Dr. Jena Questen, and for those of you that don't know, I am a holistic veterinarian based out of the Denver, Colorado area. And Neil and I like to get together here once a week and talk about some of the questions that were answered this week, or asked rather, this week in our Facebook group that we're part of that we love so much called Positive Pet Advice.
Perfect. So, Dr. Q, let's actually get started with dog house soiling. We've had a few people come in lately, adult dogs not really grasping the whole eliminating outside routine. And we also have some issues where dogs are going in the crate. They're not really picking up on, the whole house training situation. Some people recommended dog walkers, daycares. What's your 2 cents?
Neil, I'm so glad you brought this up because I actually have clients that are dealing with this problem right now, and it's so frustrating, and I'm trying so hard to help them, but it, especially in the adult dog, it can take a lot of time in order to sort of flesh out what is leading to this problem.
Right.
First of all, of course, as you've mentioned before, we need to make sure that the animal is healthy. We have to make sure that we don't dealing with a urinary tract infection or any other kind of infections that might be causing the animal to not be able to properly control their elimination.
Correct.
So once we have that in place, then we go on to the behavior piece, which hopefully with puppies goes quickly and easily, but sometimes dogs are in all kinds of different situations when they're young and don't learn good habits, and then you get them, and or even they had good habits and then they suddenly don't have good habits anymore, and then we have to figure out the behavior piece of why that's happening.
Right.
One of the things that I always tell my clients that I think is really important is if there's something that's happening that you don't want to happen, you can't let it happen.
Right.
And I know that sounds really overly simplistic, and you're like, okay, well, if I knew how to do that, I would just take care of it. Okay, but it just means that we have to use some tools to make sure it doesn't happen. So that means we're with the pet 100% of the time, or they're in a crate, or they're on a leash, or they're in a kennel, or somebody else is with them, overseeing them. So every single time they have an accident, then it's about 10 more times of having to go through this before the animal learns. So we really want to eliminate all those accidents. Neil, I don't know, you're a dog trainer too. You're a great dog trainer. Do you have any quick pointers that you would say to people at this point about that?
Health is my number one. Make sure that animal is healthy. Number 2, management is crucial. If we have to use the umbilical protocols to where the dog is physically tethered to us, just so it reminds us that you have to take them out on a regular routine. Whether you have to set a timer for yourself or put it into a calendar, management is crucial. We need to be taking them out structured. We need to be taking them out at specific times. And we need to make sure that we're capturing every time that they eliminate outside. But if we're not taking them out enough, we won't have enough opportunities to be able to capture those moments. So your management is going to be key. If you need to crate while you're not home, or if that's your way of keeping your dining room floors or whatever the case may be, that's your option. But know that you still have to put in the time when you are available to go ahead and housebreak that dog, because we understand a lot of people in modern life, you know, we have guests all over the world, but they work that 9 to 5, you know, and what am I supposed to do with the dog in that time frame? I can't be home and bringing this dog out constantly. Make sure the time that you are home is the time you're following those protocols. Unfortunately, if you can't do anything while you're not home and you don't have access to a dog walker, daycare, anything like that, make sure that you are putting in those steps and you are putting in that management to be able to proceed in the future and set that dog up for success. Doc, you're actually breaking up a little bit.
I like how you also gave people other options to think about, such as the dog walkers and the pet sitters and the doggy daycare. So those are definitely something that somebody might want to think about doing as well. I don't know that those are right for everybody.
Absolutely. I would think we would have to do an we would have to do an episode on that completely, because that can be such a drawn out discussion because of the safety, health, responsibility, and the overall competency of your professional. We want to make sure that we're going to highly rated places that have Department of Agricultural approval, licensing, insurance. These are all things that we would assume that place would have, but we should probably double check and just make sure that they are providing the best quality for your requirements.
Yes, I love it. I love how you're bringing it down to the really important things to make sure that we are protecting our dogs from any kind of harm. So, a couple of things that I have seen some people as far as housebreaking is, if it's really not going well, sometimes people just choose to compromise,
Yeah.
either by baby gating off a part of the house and putting puppy pads down and just accepting the fact that the dog's always going to eliminate in that area and it's not going to be exactly ideal, but it's sort of a compromise. Other people put in dog doors and let the dogs have free access to outside but don't have free access to inside. Maybe that area also is gated off so the dog can come in the house but then can't have free reign to just run around the whole house and eliminate wherever they want to. So
the doorbell training works really well too. A lot of people put bells on their doorknob or near their door, so if the dog needs to go out, it can alert them that they need to go. That's a great thing to start doing. I'm not a fan of the whole puppy pad placement. However, if it's the only way you can confine or consolidate the elimination zone, then that might be the best option for you. In the past, I've had success with pee post. Basically, it's a little pheromone scented post you put in a specific location in your backyard, and it's supposed to encourage the dog to eliminate in that zone. I've seen some success with that in the past. I've also seen success with people doing a small zone just outside their back door. Just a little, like, 3 foot by 3 foot section. That if you're bringing the dog there on a regular basis, it's kind of like using the mat training or the pee pad training, but it's just going to a specific spot in the backyard. So just make sure that your consistency is something that the dog will start to associate, because this is the actual key principle that we're trying to do in the behavior. In the science of it all is that we're trying to associate this location with elimination outside of the home. So if we're giving them a specific zone and we're telling them this is what you do in this zone, and we capture it every single time, we'll create that repetition, and ultimately that's our goal. That's what we're looking for. But if we're not taking those steps to manage or to set the dog up for success, utterly we're just going to sit in this, well, pool of failure. So it's really important that we think ahead and try to do something instead of what they are doing, because obviously what we're doing now is not working. So we need to be adding in these extra possibilities, or these extra tools to help us try and manage this problem.
Outdoor
Doc, we're losing you.
we have to make the indoor locations be less attractive to the dog wanting to go there. That means remembering that any accident places that we have, we're going to clean those really good with an enzymatic cleaner, and preferably block the dog's access from being able to eliminate there again. Using the pheromone collars and sprays like Neil mentioned. I've seen some good success with those as well. And then we also just have to look at our overall household situation, the reality of it. Do we have enough time? Is this a more difficult case? Is this something where maybe the pet is best put in a different home where somebody is home all the time and doesn't work that 9 to 5 and have to put the dog in the crate for long hours of time? And that was another thing that Neil, you brought up, was about how long dogs can stay in the crate.
Yeah, absolutely. Well, what's your veterinary opinion on dogs in crates for long periods of time? What's too long? What should they have access to while in their crate? What's some of your not necessarily crate training tips, but crate responsibilities?
That's a good question. The one thing I always worry about with dogs in crates is what that's in there that they could possibly chew up and ingest. Okay,
Right.
I mean, I love the idea of them having a fluffy bed and that sort of thing, but if this dog is prone to chewing these things up and swallowing them, then it's a safety issue, and so we can't have that. So that's frustrating and sad, but we have to take that into account. So a Kong that's stuffed that can provide some entertainment and not be a safety hazard, I think that's really a good idea. How long the dog can stay in the crate is really going to depend on the age of the dog and the size of the dog, and the maturity of the bladder. A small dog obviously has a smaller bladder. A bigger dog might be able to stay in the crate longer. How long is long enough or too long? There's no hard and fast. I mean, I would prefer no dog to be in a crate more than about 4 hours at a time, no dog. But for some people, that's just not realistic. They don't have a way of getting them out. And some dogs do fine with being in there longer. But just think about yourself and how you would like it if you were restricted from being able to go to the bathroom for 7 or 8 or 9 or 10 hours. And that's not fair. And it's going to lead to frustration and bladder infections, things like that.
What are some of your suggestions to crating? What are some of your alternatives?
Well, I mean, I think that if we can't. Well, let me ask you this. So, in regards to what? In regards to that 9 hours is too long to keep the dog,
Well,
or I
yeah.
guess
Would you say that they should start working out of crating the dog for such long periods? Maybe just block off a small section in the house if they're noticing that they're not doing any destructive chewing or anything like that. Maybe leaving the dog alone in your home for long periods of time. they learn to behave and things like that. But why would you need to crate your dog that long? I think that's ultimately is my big question, because I know personally my dogs don't get crated at all. If I leave the house, it's free roam of the house. But not everyone has that availability to be able to do that. So what I would always suggest is look at why the dog is in the crate, and then maybe let's get the dog out of the crate as much. So if it's you going out because you're just going to the mall for an hour, leave the dog out of the crate so you can start to see them home alone and start to let them build up that responsibility, because I think there's an impulse control and responsibility on the dog's part as well. They have to be able to assimilate to your life. They have to be able to grow. They have to be able to mature in their own minds, in their own bodies, and in their own life.
I agree. I love what you're saying, and even a camera system might help with that a little bit. But
Absolutely.
I only crate my dogs. Say we have a bunch of people coming to the house or something along those lines for safety. Again, I crate my dogs. Otherwise, the crates are open to where, and I encourage them. They often go choose to lay in there, and so they have free access, and that's how they don't have any anxiety about the crate for when it becomes a time when I do need to actually close the door.
Yeah,
So that
making
can't
it you know
happen.
making it a standard part of the furniture, I think, is a really big piece. And I can honestly say I thoroughly recommend this for my feline clients and also my bird clients, my avian clients, because it's very important that they understand how to travel, and that this piece of equipment isn't necessarily something bad. It's not necessarily something that's absolutely fantastic. It's just a management tool for a short period of time. I like to classify my crate as the same thing as my heel. I don't need a dog in a perfect obedience, competition heel constantly, but when I ask for it, I need it for that moment. That's exactly what a crate is to me. It's a heel cue. It's something that's just there. You have it when
It,
you need it.
you do. It's like a smoke detector in your house.
Absolutely.
It's like a carb. It's a safety factor. If you have a pet, they need to be able to be contained. They need to be comfortable in that containment system,
Right.
and in an instant be able to get them in there. So, but I like your segue. I think now might be a good time, unless there's anything else on the housebreaking that we need to wrap up with, to move into our next topic, which was brought up in the group this week about vomiting cats. And
Yeah. Tell me about this. I heard you had a really busy week with cats. So what's going on over there?
I did. So in the group Positive Pet Advice on Facebook this week, somebody posted a picture of something that her cat had vomited, but she said the cat was acting fine and feeling fine and eating well. And so my suggestion to her was just to kind of monitor the situation for now, because it looked like a piece of food or something maybe that she got a hold of. I'm really not sure. We'll see what ends up happening with that. But definitely seems to be the week of the vomiting cats. I did 3 abdominal ultrasounds this week in the clinic on vomiting cats. And it's just really sad. In this particular situation, we had a 12-year-old, a 16-year-old, and 18-year-old kitties.
Oh.
And the 12-year-old cat was vomiting frank blood and had been off and on, had come into the hospital a few times over the last few months for anti-vomiting medicine, and really wasn't getting better, but felt fine, looked fine, was eating okay. Unfortunately, the abdominal ultrasound showed a big, ugly tumor growing in that kitty's stomach, and it was so sad because of all the cats, that one was the youngest
Yeah.
of the 3. So that kitty's going to have exploratory surgery, and that's all we can do. Is
Are
we're just waiting for that to
you
get scheduled.
are you doing the surgery?
I'm not sending that one to an internal medicine specialist,
Okay.
or not one, a surgeon rather, because of the location of it. It's very high up near the esophagus, and I just think that it's something that I think in some cases it's best to get the best people that you can for something along those lines. So I definitely recommended she have that done by a board certified surgeon.
Absolutely. And Doc, thank you so much for pointing that out, that It's really important for a professional to understand their skill set, to understand their mindset, and to understand their practical skills, and to be able to say, this is not something either A, I'm comfortable with, B, that's actually in my service criteria because I generally don't do that. Or C, I don't know. Let's get a second opinion. And I think it's very important that professionals be able to do that because we are finding that a lot of professionals are so stuck that they're not willing to accept criticism, or they're not willing to ask for a second opinion, or they're not even willing to say, that's not something I can do for you, or even offer another suggestion. So thank you so much for doing that. That you are one of the highest on my on my favorites list.
Thanks. I just feel like, when you're dealing with something complex, more brains trying to figure out the solution, it has to be a good thing. So, but my best wishes to that kitty and her family, and hopefully everything goes well with that surgery.
I
The
agree.
other the other two kitties, now this is going to be more practical sort of information for everybody out there. So both of those kitties were, well, one was losing weight, not vomiting, to be more accurate, but the other one was also vomiting blood. So what we found on the other kitty that was vomiting blood is just um, inflammatory bowel disease. And that's
Right.
actually what we found on the kitty that was losing weight as well. And so that's sort of, as you know, Neil, something that is very frustrating diagnosis, because it just means that we have inflammation all along the lines of the intestines. They're angry about something. We don't know what, probably an allergy of some kind. So then we go, well, gee, has there been any changes in the food? Maybe we need to change the food. I know for my own cats, I cook for them a lot. And sometimes if I'm busy and traveling and I don't have as much time for that and I feed them dry food, they vomit more. And so I don't know if that's a lot of people will say, oh my gosh, you have to do grain free. Oh my gosh, you have to do gluten free. Oh my gosh, you have to do this, you have to do that. We don't have to do anything because we don't know.
Yeah,
you know,
exactly.
going gluten free is great if you're allergic to gluten, but if you don't know that, then it's really kind of a waste of your money. It's more like we have to do, without more specialized testing, all we can do is some trial and error and kind
Right.
of see what works and what doesn't work. But whenever you definitely see, cats are a little bit prone to vomiting. That's what they do. They swallow their hair, clean themselves, and then they vomit. And if there's a bunch of hair in their stomach that they haven't digested when they eat, and if they vomit almost right afterwards, and it's mostly just their food, then you can be pretty sure that that's just hairballs that have kind of accumulated in the stomach.
Right.
There's I don't know if any of your clients, Neil, have something that they like to prevent hairballs and kind of keep the vomiting to a minimum.
I do know a few that they say some of the hairball diets and things like that tend to help a little bit. The grain free tends to help a little bit. As you did point out, cats just kind of do that. It is what they do. It's in their nature. And one of the things I like to point out is, I don't know if everyone remembers back, but if you remember way, way back to like your first like natural science classes and intro to biology, probably in high school, you learned what owl pellets were and how owls will regurgitate the bones and the skin and the fur and everything. Cats do the same thing. It's part of their actual anatomy. It's natural for them to do. So I always like to point that out to people, that they understand that, sometimes these, even if you look at the big cats, the lions, the cheetahs, everything, they do the same exact thing because some of the bones don't get digested and some of the things don't get digested. So don't worry all the time. However, if you are noticing that you have things like bright red blood or very, very dark blood, you might have some issues. Go to your veterinarian. Above all, if you're worried, seek veterinary assistance. That's always my number one. My number one. If the veterinarian clears you and you're still having a problem with food digestion or hairballs or things like that. Look at some of the items that might be being regurgitated. These might be irritating the intestinal lining, which could be causing them to be regurgitated. Are they eating their toys? Are they eating things around the house? Sometimes they'll eat walls, they'll eat, all sorts of different things. I've seen cats tear everything apart. You have to make sure that you are taking the necessary steps to understand what is the actual problem. It's not just, okay, let's find a solution. What was the problem? Because that's the only way you're going to make a good solution.
I agree. A cat swallowed. I actually had a cat one time. So wait.
We're losing you.
I had the craziest thing I have ever seen that a cat swallowed was a needle and thread. And I actually did surgery and removed that needle and thread from that kitty's stomach. And I kept it, and I have it in a baggie on a clipboard.
That is awesome.
It was amazing. And that cat is doing fine, and it's been many years since that happened. So
wonderful job, by the way, Doc.
I don't know. I don't know what they get into sometimes,
Skilled
but they do
hands.
get into some things.
Actually, I did want to ask you just a fun little quirk for today because we have the access to it. And so Lisa, the wonderful Miss Lisa White, CPDT down in Barbados, and another fantastic admin on Positive Pet Advice, #us, please. If you could have one dog breed from every AKC group, which one would it be? You don't have to tell us why, but if you could do every group, which would it be?
List off the names of the groups, and I'll. This would be like a speed round. We'll see how quick I can do it.
Okay, working group.
Roddy.
Sporting group.
Sporting. What's this? What are sporting dogs? Like GSPs? Or no?
Yeah, GSPs. Yeah, GSPs, Goldens, Labs, Pointing Griffon, Vizsla, the Setters, your Spaniels.
Well, I guess I already said it then.
Which one? You want your short hair pointing, your German short hair pointer.
My German short-haired pointer, I think, would probably be a good choice, even though, boy, they'd be hard to deal with their energy level.
Oh, they're so much fun, though. What would be your terrier?
What would be my terrier? Gosh, this is tough. I see this dog in my head, and I can't think of what it's called. They're the ones that look, have little smashed-in faces. They're about this tall, black and tan. Help me out. You've got to help me. Well,
if it's a terrier, it shouldn't have a smushed in face.
Yes, this one does though. This one does. Not a Manchester. I don't know. I would probably go with Manchester, but the one I'll come back to you on this one.
Okay.
I had a client that had one.
What about
not so much like a pug, but just a little flatter.
Would you classify it as brachiocephalic?
No.
Okay.
No.
We'll come back to that one. Non-sporting. Dalmatian, poodle, chow.
English bulldog.
Ooh, very good. Now, that's another episode for us. I have very strong feelings for English bulldogs and French bulldogs, and it's not in the way people would actually think that I would go.
Like Frenchies?
I love them, but at the same time, there's a shame. Shame.
I think there's a story in there.
Yeah, oh yeah, there's a story in there. Okay, so we have sporting, non-sporting, working, terrier. What would you pick for your herding?
An Aussie. No, Border Collie.
Border Collie? And what about hound?
Oh, I would like to have a coon hound. I'd really like to have a black and tan coon hound. I'd really like to have one of those.
That's a good one. Oh.
I grew up on coonhounds, so I have a special place in my heart for it.
Aw, that is so adorable. Well, Dr. Q, I don't want to keep you too long, and I want to say thank you so much for coming with us on your Hot and Health Topics with Dr. Q episode today. If you have any questions, feel free to go ahead and tweet Dr. Q at Dr. Questen, and you can reach me, your treat fairy, anytime. Dr. Q, thank you so much, and have a wonderful day.
Thank you, Neil. Thank you, Treat Fairy.
Bye.
Like Neil, subscribe to my YouTube channel if you like it, the one Dr. Q, and we'll see you here next week answering your questions. Have a great day, everybody. Bye-bye.
Bye-bye.